Welcome to 60 Skills. What is distance healing? Distance healing, traditionally speaking, involves the employment of vital, astral, or mental energy to impact the health of another human being. This may be performed at a distance from several feet away, or a couple of meters, and is traditionally referred to as no-touch or non-touch energy healing. However, distance in this case does not really matter. In point of fact, this technology can be employed at any distance, from several feet to halfway around the planet. Interestingly, it does take a moment or two for the energy to reach the person on the other end, depending on the kind of energy that is being employed. Most of the effects that you will see from distance healing have to do with the astral or the mental. Additionally, distance healing generally only works when a practitioner is actively engaged in doing it. This is a little different from some mental level practices which can use a recording. However, we will get later on in the course into a more concrete discussion of what this means. Please keep in mind that when you are engaging in energetic healing, the limitations of this modality. If someone is missing an eye or a limb or an internal organ, I have met no one and seen no verified examples of anyone utilizing energetic healing in order to result in that organ, limb, or other appendage regenerating. I simply haven't seen it. I have seen no verifiable cases of this, etc. Also keep in mind that energetic healing is simply one modality of many that can be employed towards human health. If you have a bacterial infection, you need access to antibiotics. They simply work very well and are the preferred way of dealing with this. Generally speaking, energetic healing is used for things that modern medicine does not have an answer for. If not, you're usually better off going with a more conventional option. For example, if you have a gunshot wound, please go to a hospital. Energetic healing is not the ideal way of dealing with this issue. Additionally, keep in mind that when engaging in energetic healing, you have to be very careful about how you broach this with other people. If for no other reason, then many countries can have some rather draconian and severe legal ramifications for engaging in medical practice without a license, or for that matter, promising results for something that cannot in fact be verified. This is one of the many issues that you run into when you begin to study medicine. For example, in medical school, one of the first exercises students are given is to define health. The simple fact of the matter is, health is something that most people can intuitively see in someone, but have a very difficult time defining. The best definitions of which usually center around something nebulous like an absence of pathology. The fact of the matter is, health in general has no concrete meaning. The simple fact of the matter is, medicine in general is devoted to dealing with various pathologies. Some methods are more effective, some methods less so. Energetic healing, while it has a very long historical tradition and certainly demonstrates a certain degree of efficacy, is again something that treads upon the territory of a very well established community of practice in most modern countries. And any energetic healer needs to keep this in mind. This is particularly important when advertising or when trying to engage the public in order to generate more clientele. Because I do not know what time period this recording is being heard in, and I do not know which countries it is being broadcast in, all I can tell you is that if you choose to engage in the practice of energetic healing, you additionally need to be very cognizant and careful regarding whatever your local laws and regulations are regarding the promise of medicine, practice of medicine, and the promise of results. So, that being said, we will now get into the exact details of how energetic healing or distance healing is in fact performed. Let us begin. Welcome to 60 Skills. I will now discuss the requirements to engage in distance healing. Well, first of all, you need to be able to vital or pore breathe. At a minimum, you will want to be able to use vital energy in order to conduct these techniques. Although the truth of the matter is, any of the subtle energies may be employed to do this. Additionally, you will need someone else to work with. The simple fact of the matter is, distance healing is not something that can generally be practiced so much as it can be performed. So, as long as you have the ability to engage in pore breathing or vital energy, and you have someone else to work with, distance healing is something anyone can do. Welcome to 60 Skills. We will now talk about the differences between nearby and far away. As has been mentioned in this course several times at this point, both astral energy and mental energy can impact another human being from quite a distance. So you don't necessarily need to be right next to somebody to impact them. That said, there is a difference between distance healing and healing somebody who's right in front of you. This gets into the question of vital energy and what it represents exactly. Vital energy, in the opinion of the person speaking to you right now, is in fact a subset of astral energy. This energy is very much constrained by space and much more greatly constrained by time. It, much like astral energy, is in fact generated by breath. If there's no breath, there's no vital energy. And vital energy doesn't seem to reach very far. This is the reason why hands-off teaching by healing by somebody who's a meter or several feet away seems to have a slightly different effect upon a patient than distance healing conducted from halfway around the world. Now that said, depending on what you're dealing with, the differences are not that big. As a practical matter, what I can say is if you are attempting to remove stuck or negative energies that cling tightly to the body, being closer to a person seems to be much more helpful. Again, for legal reasons, I cannot get much more specific than that, because that would constitute making a medical claim. Suffice to say, if you are dealing with a sticky and or concrete energy that holds close to another person, being near them when you go to remove it is much more effective than being from far away. However, that isn't really the majority of what most people are going to spend their time on. So keep in mind there are some minor differences between working with energetic healing in close proximity to another human being and from far away. But in general, they're not very important, with the exception of dealing with very tight, clingy, congealing, or sticky energies, in which case being closer to the person is more helpful. However, if you're doing this as a practitioner, you need to be careful about working with those sticky, congealing, or tightly constrained energies. The simple fact of the matter is, pulling those away from somebody makes it much easier for those things to stick to you if you happen to be very close to them. If you happen to be very distant from them when this happens, while your effects at this won't be as pronounced, it will also be much harder for those sticky things to stick to you. So keep in mind the need for good esoteric hygiene when performing these practices, as the closer you are to somebody, the closer you are to their near physical energies, and generally speaking, the stickier those energies tend to be. Let us begin. Welcome to 60 Skills. We will now discuss the need for contact. In energetic healing, many schools of this involve a kind of esoteric massage, maybe something like bone setting, this kind of thing that results in the practitioner directly touching the patient. If you are going to engage in this kind of energetic healing, you need to be very healthy and very strong yourself, because the closer you get to the patient, the greater the likelihood of transference of energy between the patient's pathogen and the practitioner. It's a simple way of stating that if you touch people energetically, it's much easier for their energy to enter your body. And if you are doing this with someone who is very ill and you are very sick or very sensitive, you as a practitioner are going to absorb some of this. It is also the case where if you were doing this commercially or in a scenario where you were treating large numbers of people, it is very easy for this energy to backwash into a practitioner. In this case, these things can build up in the body and create a variety of health effects that take on physical manifestation over time. It's one of the reasons why the more aggressive systems that involve physical touch, the practitioners tend not to live that long. Now, there has been no double-blind study involving any of this, so I cannot make anything involving technical claims possible. But I can say that I have been told by several of my teachers, none of whom knew each other and all of whom were from different systems, that certain things, particularly certain forms of cancer, are in fact, in their words, catchy. Energetically speaking, cancer, in many cases, tends to feel like it is something that is alive. And when that energetic vibration gets into the body of a practitioner, it can be very difficult to get rid of. Specifically speaking, you should never touch the tumors of a patient. This is a very, very bad idea and tends to make most people who are energetically sensitive sick for a few days afterwards. I myself have made this mistake on a couple of occasions when I went to work on somebody and had no idea what their actual problem was. As has been mentioned many times before in this course, you have to be very careful regarding what you promise to be able to do for other people, making any kinds of claims, and your interaction with the medical community writ large. If you were doing this in a non-professional manner, in other words, not charging money for this, and not offering medical advice in a commercial setting, if you are simply using these techniques to help loved ones or people who are very close to you, generally speaking, you're going to be okay in terms of the legal world. That said, if you deal with an individual or several individuals who have advanced cancer and you are not careful with your energetic practices, a lot of that energetic form is going to get into you. Now, also keep in mind what can and cannot be treated with energetic medicine. If someone has a dislocated ankle, at some point, the ankle must in fact be set and put back into position. No amount of energetic healing is going to fix that. Likewise, if somebody is missing an eye, no amount of energetic healing is going to cause them to regrow it. That said, energetic healing can greatly compound the efficacy of manual therapy. So if you're a bone setter or massage therapist, and you combine that with distance energy healing, your general effects are going to be much more pronounced. So keep in mind, for some things you need to be able to touch people. For example, adjusting a vertebra in the back or setting a dislocated ankle. Other things you want to be very careful about in terms of touching other human beings. Cancer patients in particular, you should try to avoid using manual therapy with. Again, the closer you are to the person receiving your energy, the more pronounced the vital effects are going to be. The further you are away from your patient, the more effective the astral and mental components of that treatment will be versus the vital. So none of this is an all one or all other type thing. And keep in mind, having a great deal of energetic strength can change a lot of these parameters very, very, very quickly. That said, if you want to get some ideas about what is capable, I would advise you to go look at some of the older Russian and Chinese research involving esoteric energy and non-touch healing. Let us begin. Welcome to 60 Skills.
I will now demonstrate hands-off energy healing. An important factor to keep in mind with this is taxing to a practitioner to varying degrees. So if you do not feel well, or you're tired, or otherwise are having some kind of physical problem such as being in pain, you should not engage in these techniques. Not only because this will be draining to your personal energy, but if there is something wrong with you, it is also possible to transmit that to the patient, and this is something that you do not want. Also, keep in mind you don't want to go too hard when doing this, particularly in the beginning. Some patients are very sensitive to energy, and they can pass out or have other reactions to this. So the key here is you only use as much energetic force as is necessary to rectify the problem. Because of this, if a patient is particularly weak or old, it may take many sessions to work on them. Also keep in mind that reactions to the healing process, sometimes referred to as a healing crisis, are known to happen. So when using energetic healing on a patient, it is best to work a little bit at a time unless the situation is particularly dire and requires a severe intervention. Let us begin. So I will assume a shoulder width stance. For the most part, I'm going to be using an electric body posture if I'm pushing energy into a patient. If I'm pulling energy out of a patient, I'm going to want to utilize a magnetic body posture. You must be careful with this, however, because you don't want to get anything that's stuck in the patient into you. And when utilizing a magnetic body posture, it is very easy to absorb some of the negative energy, or essentially grunge, from your patient. So you need to be careful with this, and again, only engage in these practices when you're fully healthy yourself. So I'll start again with the handshaking position, go back to the first place where I found something. I will gently reach into the patient's electric and magnetic field, grab a hold of the thing, and gently pull it out. Then when I've done this, I will go into an electric body posture and push energy into the patient to backfill what I have removed. Then I will go on to the next thing that I've found. In this case, he has a neck injury, probably from martial arts. Again, going slightly magnetic. Then push energy into backfill. You can link this to the breath if you like. It is up to you. Some people just use body posture. Other people like to use certain hand gestures. Smooth it over. Okay. Fill it in. Sometimes patients will describe a warm sensation entering the body. Now I'm down to the knee. Project energy again. Again, as is always the case, you may want to use a technique like the secret smile to program your energy beforehand if there's a specific outcome you wish to apply to a patient. This is particularly useful when dealing with a long-term patient whose treatment history you are very familiar with. I've done the front of his body on one side. Now I'm going to do the other. Now there are a couple of different ways you can project energy. The most common is to use the breath and to move the energy from the practitioner into the patient. However, with practice, you can pull the energy directly from the universe into the patient. This will generally be weaker, but it provides an additional buffer between you and the patient. Now, sometimes when you're working with the patient, nothing's going to be stuck. There's simply going to be a deficit of energy. In this case, you don't need to remove anything. You just find that place and you just gently and softly push the energy in. Or call the energy from the universe. Smooth that thing over. All right, go ahead and lay down, head facing this way. Okay, in this case, I've worked on the patient while he's seated, but perhaps I found something maybe in a hip that I need to get to. It's not really convenient to do that. Or perhaps the patient is very debilitated and their energy field just doesn't stick out very far. In this case, I can have them lay down in a comfortable position. And then again, move the hand over the body, feeling for that place. And when I find it, then fill it back in. If you have any medical mantras or prayers you like to use, this is a good time to apply those. I've done the one side. Fill in. Smooth it out. All right, I've now covered the patient on both sides of the body completely. If you want, you can flip them over. Again, the main thing in this case is you want the patient to be as comfortable as possible. So having pillows or other ways of propping them up in the event they have movement limitations is very helpful. Let us begin.